seems that it says holistic. So that's it. It's about looking at the whole picture. That's what we mean when we're talking about holistic care. And in my opinion, when we think about holistic health, we need to look at two areas. One of them is the patient, and the other one is the care system. So this is how I think, if we try to implement sustainable systems for mental health in Sierra Leone, they need to account for holistic visions in these two components. So what do I mean when I say the whole patient? Well, I mean basically it looks a little bit complicated, but it's very easy. This is basically to represent that a human being is never, and I think we all know here, because of all personal experiences, a human being is never only a body, or only a mind, or only the physical things that this person owns. A human body is a composition of multiple things that we have more or less in this circle. So we have the occupational, so we have obviously the body. We all have a body, bigger, smaller, we all have one. We all have our mind, our emotions, everything that is going on behind our body. But we also, and I love that this country has a lot of this, we have a spiritual component. And none of us will be the same person without that spirituality behind. So it really affects who we are. And we need ideas, knowledge, education, all of that is also part of a human being. And of course, we need things to do. We also like to sit and do nothing sometimes. We need to do things, we need to be engaged in activities. And all of that is always embedded into society. So most of social psychologists agreed long time ago that human beings are social beings. We don't know how to live alone. We don't know how to live isolated. We need the others to feel happy, to feel engaged, to fulfill many of our basic needs. So this is what I mean when I say that the patient needs to be taken into consideration as a whole. So when we're providing services, and mental health is not an exception, of course, we need to give the physical care. We need to look at the body. We need to give medication. We need to look at all the conditions present, and we need to promote health as well. And so as I talk through the components, I just want to highlight how sometimes it seems that with mental health we forget some of these things. Okay? So, for example, sometimes check for other conditions is not that frequent when we're talking about mental patients. Because we don't care that often. We're focusing on controlling their behavior, we're focusing on trying to calm them down, all these things, and nobody's checking if that person is having a very severe malaria that is having an impact in the brain, and that person therefore is having worse and worse symptoms. So sometimes we forget about these things. Actually we, I say we forget about these things. And of course the promotion of health as a very important component of the physical area. We need to look at the emotional component, and unfortunately it's been taking a long time for medicine to accept that the mind has a massive impact on the general physical health of individuals. So now we're doing better, and we are in psychotherapy, counseling, training, just to help people to have certain skills. You don't need to have a mental condition to go and visit a mental health professional. You might just need to increase some of your capacities and abilities to cope better with life. Even if you're perfectly sane, no problem, you can go and seek support anyhow. So we are helping this, and now the systems are getting better. So holistic health system might combine, for example, in the case of the patient with cancer, with a very severe cancer, more and more frequently they are adding psychotherapy of the difficulty that is involved in dealing with such a difficult disease as cancer. And then we have all the other components, and we can't forget about all the other components. So when we want to provide better health services, we need to check if the person is having an opportunity to learn, to expand their minds, if they have access to education. We need to look at the occupational work, or both work-related activities and in other type of activities. The number of studies suggesting the high correlation between not having a job, being unemployed, and suffering severe depression is very, very high. Well, thank you. And then the spiritual component. So, to allow the person to engage in religious activities, to receive spiritual guidance for whoever is the most important person to have. We're trying to look at all this picture right now instead of focusing only in one area. I think we all agree that you might have all the money in the world, but if you have absolutely nobody around you, you're not going to be happy. You can also be surrounded by people, but if you can't eat because you have no money, you're not going to be happy either. So we can't just forget any side of the picture. This is especially relevant when we're talking about mental health. Persons with psychosocial disabilities, that's the PPSA, have very frequently poorer physical health than persons with psychosocial disabilities. Having a poor health can help developing psychosocial disabilities. So if you don't have very good health, you might have mental health problems. If you have mental health problems, it might happen if you have a poorer health. So when we are investing in things like improving physical health or helping people to stop smoking, I'm smoking myself, so or take care of nutrition and physical programs, or look at all the ecosystem problems, we're helping in two ways. We're helping those patients with psychosocial disability to recover better. We're helping people with bad health to prevent psychosocial disabilities. So just by focusing on things that are cheaper, because they don't mean spending lots of money on medicines, etc., by promoting and trying to implement healthy behaviors, we are having a double effect. And just to give a little bit more examples, I just wanted to say that the famous phrase of there's no hell without it's not just something that we keep on saying to encourage ourselves and advocate with the Ministry of Health and Sanitation. It's just not a phrase. It's a reality that many scientists have proved. If you just take the Lancet series of 2007, there's a wonderful paper by Ethan Patel that describes very easily how those with mental disorders have a very significant greater risk of illness. In things like heart disease, persons with depression and anxiety normally are at higher risk of heart disease. Persons with schizophrenia have 5 times higher rates of diabetes. And sometimes maybe say that we don't have the resources to check on the diabetes of those patients as a psychiatric hospital. So we're having higher risk here. Alcohol obviously injures the liver and other creates other problems, malnutrition and maybe other correlations. And that's the 2 hours and the other way around. Okay? So there's a great